Good day. Many times I've seen this very difficult situation and I listen from the clients. I don't say them as patients. I say them as clients. We want to be very soft centric to our patients. So I generally tell my team to pronounce them as clients rather than as patients. So I want to keep them as clients. So I hear from the clients, they say, I'm suffering from diabetes and it's my lifetime. Have you heard of this? It's my lifetime. Is it something so? Have you taken a curse that I should suffer from diabetes for your life? Is the truth? Are you sure that this is your lifetime? So please think it over. And many times in the initial stages, I've seen from the clients when they are found out diabetes, they feel their life is lost because they feel I cannot have a sweet, I cannot have a sugar in my drinks, beverages. After the lunch, we take lot of salads, and I mean the ice creams, all these things, we miss it out. That is the most delicious dish. We don't lose it, right? So these are the things which makes us feel that my life is lost because I couldn't eat any of these things. I might not feel happy when I am going to have a gathering or in a social function where I'm be restricted to take most of the diets which is recommended to avoid having a diabetes, right? Is it true? Have you come across such thoughts? Am I right? Okay, the second thing, many of the clients will ask me, can I come out of this medications? Is it medications should be on a long term? Many of the time the doctors will tell it is all depends on your hands, that if you are going to control with a proper diet and a proper physical activity and a proper lifestyle, yes, your diabetes can be taken off away from the medications. But I want to be one among you. In this modern world, in this mechanical world, in this world where there is full of stress in any profession, you name any profession or you think of any profession that is completely free from stress. Every profession has its own challenges. There is no profession that is have a complete, very comfortable life at all. Every profession has their own challenges. So stress is inevitable in life. In that condition, how can we have a regular, timely food, a proper diet, a proper sleep, a proper physical activity? Yes, they are very, very mandatory. But something can be done in myself, looking these all the factors at a subtle level or in a small compromised level, in suiting for my life needs, suiting for my work needs, suiting for my family needs. Can I do something that I can stay off the tablets, off the medications? This is something we need to understand. And the worst situation, I've seen this. Many of the clients are on insulin and they feel they are totally depressed. The moment when we tell them your medications are not supporting your control of diabetes, you need to step up to insulin, they feel the life is lost. Oh my God, I have to take injections. That means my sugar is not under control. This is something very shocking and very surprising. And on the top of it, I see from the clients, this diabetes and the sugar is one ailment which can affect from the air right to the toes. It can affect the entire body. It can affect the nerves, neuropathy. It can affect the eyes, retinopathy. It can affect the kidneys, nephropathy. It can affect the heart. You can get the cardiomyopathy. All the pathies will happen. It can affect all the major organs. It can affect the blood vessels. So diabetes is one thing, it's a killer disease. So what is going to happen when someone is going to face diabetes? They feel that's an end of my life. I'm developing one by one complications. So this is something alarming. So we need to understand, we need to emphasize ourselves. Am I going to save resources to spend for my future? Rather, I do understand my health is the biggest resource which I can do for my life. So I will give you an open statement and I'll give you an open challenge for everyone. Are you suffering from diabetes? Any of your family member is suffering from diabetes and you are supposed to watch this video? Please note on these two investigations and ask them to go and test them. I'll just give an open challenge to everyone. This is something you need to understand. on an 8 to 10 hours of fasting. You go to any better labs, whatever the lab you feel that is good at your heart. It's a very professional lab, very standardized lab. It is very cost effectiveness. Go to that lab. Just give these two investigations and see. On a fasting, you do your insulin levels and you do your C peptide levels. And you will be really understanding what is happening within yourself. If you see your insulin is beyond the reference range, higher than what it is in the reference range, that means you are having a surplus amount of insulin in your body. And C peptide is one which determines the level of function of your pancreas. The pancreas is an organ which is in the stomach or in the abdomen. So in that organ is where the insulin is secreted. So if you feel both the reports seems to be normal by comparing the reference range, and contrarily insulin is secreting more than what is expected, then what is the role of having your medications, tablets, insulin, and still you are stepping up on all these things and you are going ahead, you are facing the complications. Don't you ever thought of this? And many times when you go to doctors, what they say, when you are taking one tablet, they step up to 2 tablets when it is not under control. When you take 2 tablets on a diabetes not under control, they step up to the 3rd tablet. Sometimes they go on to the insulin. Even a patient who is on insulin, if you see them, their insulin level will be abnormally high. So what are we moving forward? What are we understanding? So this is where our facility ALM AYUSH comes into picture. Our approach is totally a very different of its approach. It's an international recognized response of treatments called functional medicine. We integrate modern medicine with an Indian system of traditional medicines, and we do it as a functional medicine, which is very popular in the Western countries. But it is not that popular in our Asian continent, subcontinent, or in the Indian subcontinent. We need to sensitize ourselves. Or you really want to look after your diabetes, you want to have your normal diet, you want to wish to eat as you wish on an occasional basis, and you want to keep yourself fit, you want to keep yourself health, and you want to have a stress-free life, you want to have a proper sleep, and you want to be happy in your life. Yes, now it is a time has come. Take it as a challenge, walk to us and feel the difference. If you are going to really cooperate with us, I can assure you your diabetes can be reversed. This is the challenge. Now, diabetes is not a killer disease or a lifelong disease. You need to understand it is in your hands. If you are going to take an initiative, if you are going to take a small efforts, I'm telling the word small efforts. If you are going to cooperate with me, I do understand in whatever the way you are going to be, in whatever the stressful work or whatever the working environment, it is my responsibility to ensure that our team will make sure your diabetes is getting completely recovered with your cooperation. So looking forward, if you are located at any part of the city, don't worry, whether in India or in overseas. We are based at Chennai at the present moment, but we will expand. We will go nationwide and international wide. You can connect to us a video conference, telemedicine. You can connect to us. We can recommend you the investigations at your nearest place, and you can get the evaluation done. Once in a while, you can come to us for a detailed evaluation for a day. An overnight stay will fulfill us all your evaluation completed, and then the rest of the treatment can be done from your hometown. So it need not be in Chennai. It is at your doorstep. We are going to deliver the services in such a way there is no way that going to prevent you from restoring your health. It is in your hands. So please get the test done, understand where you are, and connect to us if you want to get your health restored. Good day.